This is Michael Smith of MedPage Today. I'm in San Diego at the annual meeting of the American Thoracic Society. A perennial problem for doctors is persuading patients with chronic conditions, such as asthma, to take their medications. One possible solution is using electronic medical records to keep track of dispensing, and then use an automatic phone calling system to remind patients to refill prescriptions, according to Dr. William Vollmer of the Kaiser Permanente Center for Health Research in Portland, Oregon.
Kaiser has an electronic medical record, so we're able to scan the record each month and say, okay, who is either due for a refill or who is overdue for a refill. We also looked at a third class of people, which are people who were newly prescribed steroids, because we thought they may need a little bit of special handholding. Not used to taking this medication, we're going to call you and just say, how's it going? Do you have any questions?
The researchers tested the system in a randomized fashion in nearly 9,000 patients, trying to make it both unobtrusive and effective.
Well, the average person over the course of this 18-month study got 3 to 4 calls. So we didn't try to make it overly burdensome to you. We limited the number of calls you would get. And the actual calls themselves were 2 to 3 minutes in length on average. So they were very brief. And people liked it. We did focus groups and said, what's going to work for you and what's not going to work for you. In all, we looked at 8,600 members, a lot of people. Half of them were in usual care, half were randomized to the intervention group. And they're divided into 2 groups. About 7,000 of those were in our sort of prior user group. So those are people who, in the parlance of epidemiology, we call those secondary adherence. So they're already using the medication, we want to just improve their usage. And then we had a smaller group of about 1,600 new users, people who were new to the medication.
The system did appear to increase adherence, but what other benefits it might have had are still not known.
In terms of our results, we got what we hoped to get. We had a modest but statistically significant effect. We increased the average adherence by about 2 percentage points. So on average, went from 38% to 40%. Now, we don't yet know what the clinical impact of that is, and we just finished, the call is finished in April.
In San Diego, I'm Michael Smith, MedPage Today.